Hi, my name is Kathleen. I'm going to be the nurse for today. I'm going to be doing a focus assessment on your head, neck, and face.
Okay.
Can you just make sure and identify your name, please?
Amanda O'Higgins.
Okay, perfect. Okay, everything matches. Okay, let me go wash my hands and I'll be right back. I'm going to be inspecting your head and just the size of it. Okay, it's normal. Your hair is healthy, no lice, looking good. Okay, I'm going to be palpating your temporal artery. Okay, and your temporal mandibular joint. Can you open your mouth for me, please? Okay, can you close it? Perfect. Okay, I'm going to be auscultating your temporal artery right here. Okay. Okay, perfect. Now I'm going to be inspecting your face for symmetry. Okay, good. Can you smile for me? All right, your facial expression's good. I'm looking for any involuntary movements, edema, or lesions. No, you look great, okay? Okay, now I'm going to be palpating your lymph nodes. I'm going to start right here with the preocular, okay? Right here behind with the posterior auricular, okay? And then I'm going to go back here with the occipital lymph node, okay? Then the jugulodigastric. And then I'm going to go down to your submandibular, submental, okay? The superficial cervicular lymph node, okay? The deep chain cervical right here, okay? The posterior cervical, and the supraclavicular. All right? Okay. Okay, now I'm going to palpate your salivary glands. All right, the parotid right here. Okay, submandibular. All right, and sublingual. Okay, I'm just going to check your tracheal positioning, making sure it's in the midline. Okay, it's nice and centered. All right, looking good. Now I'm going to be palpating your thyroid. So I'm going to palpate here your left thyroid lobe. Right here, okay. Your isthmus. And your right thyroid lobe. Can you swallow for me? Okay, good. Sorry, swallow it again one more time. Okay. All right, I'm gonna go from the back and use the posterior approach, okay?
Okay.
Okay, can you swallow for me? Okay, good. And swallow again. Okay. One more time, just to make sure it's nice and centered. Okay. Now I'm gonna be auscultating your thyroid. Okay. Let me get my stethoscope. Okay, I'm gonna be auscultating the thyroid using the bell. Okay. Can you swallow for me? Okay. And then one more time. Okay. Perfect. All right. Okay, now we're going to be measuring your visual acuity exam. So right here I have the Snellen chart. And which line can you see the most clear?
4.
4, okay. Can you close your cover your right eye for me? Can you read me the letters on line 4?
LPED.
Okay, can you read it backwards now?
DEPL.
Okay, perfect. And can you switch the other eye now? Right?
LPED.
Okay.
DEPL.
Okay, perfect. All right, now we're going to be looking at your near vision. So can you cover your right eye again for me? And then read the line that's most clear to you. Which line is that?
5.
Okay.
PECFD.
Okay, backwards.
DFCEP.
Okay, and then the other eye?
PECFD.
Okay, backwards.
DFCEP.
Okay, perfect. All right. Now I'm going to be doing the confrontation test. Can you cover your right eye for me? Okay, you let me know when you can see your fingers, okay?
Yeah, I can see it.
Okay.
You can see it.
Right.
You can see it.
Okay, now the other eye. Okay.
Mm-hmm. Yeah.
All right.
Yeah, I can see it.
Okay, now I'm just going to be assessing and inspecting your pupils. I'm going to shine my light at you. Okay, normal dilation. Okay, now I'm going to be doing the H-test. Just follow my finger, my pen knife, okay?
Okay.
Okay, normal ocular motor skills. And now I'm gonna also be doing the accommodation test. So I'm gonna have my finger here. Can you look at the wall behind me right here?
Yes.
Okay, and right here, and on the top right here, and right here. Okay, now I'm gonna be doing the diagnostic positioning test where you just look at my finger and I'm gonna move my fingers around, okay?
Okay.
So just look at my finger. Okay. Okay. Seems normal. Alright. And now I'm gonna ask you to do the cover test. So can you cover your right eye for me? Okay, good. And your left eye? Okay, good. Your pupils are normal. Everything's normal, okay? Okay, now I'm gonna inspect your eyes and the external structures around it. I'm looking at your eyebrows, your eyelashes, they look good. The alignment, there's symmetry, okay, and they follow my finger, okay? The sclera looks nice and white, and the lacrimal apparatus also looks good. Your cornea, okay? All right, you're looking good, okay? Now I'm gonna use my scope right here to inspect the ocular fundus, okay? I'm gonna be looking at the optic disc. I'm just making note of any of the color, shape, the cup disc, okay? It looks normal. I'm gonna look at the vessels. Okay, look up for me, okay? Okay, I'm just gonna make sure that there's alignment, okay? There's retinal vessels. And last, I'm gonna look at the macula. Okay, everything looks normal, okay? Okay, now I'm gonna be inspecting your ear. I'm looking at the size and the shape of the auricle and the placement on the head. Everything is normal. I don't see any bumps, lesions, lumps, nothing like that. The redness, there's no redness. Okay, and there's no excessive cerumen or any discharge of any sort. Look here, look behind. Okay, everything looks normal. Now I'm going to be looking at the external part of the canal with my otoscope. Okay, no excessive cerumen. I don't see any redness, no inflammation of the walls in the canal. Everything looks normal. I'm going to be inspecting the tympanic membrane. I'm going to be looking at the color. The tympanic membrane should be flat and should be bulging. Okay, everything looks normal. Look one more time right here. Okay, yeah, the membrane should be flat and shiny. Okay, all right, looking good, okay? Okay, now I'm gonna be testing for your hearing acuity, okay? I'm gonna be doing the voice test, and essentially you're just going to reply to whatever I tell you in your voice, okay? Can you just put your hand like that, okay?
FIU.
Okay.
FIU.
Okay, sounds good. And you're responding to me good throughout the conversation, okay? Okay, now I'm gonna be using the tuning fork to test your hearing acuity, okay? I'm gonna tap it on the table and I'm gonna put it at the top of your head, and you just let me know when you stop hearing the sound, okay?
Okay.
Okay. Now I'm gonna be doing that to both sides of your ear, okay?
Okay. There.
And do this other side.
There.
Okay, all right, that was good. And now I'm gonna be inspecting the external parts of your nose. Okay, it's symmetrical, no deformities or any lesions to look up for me. Okay, yeah, the septum is normal. I'm gonna be doing the palpation test. Can you just cover one nose, please? And then breathe in with that. And then the other nostril. Okay, normal breathing, correct?
Yes.
Okay. All right, now I'm gonna just be looking at your nose with my nasal speculum. Okay, I'm gonna be looking at it with the color and integrity. Can you look up for me, please? Okay. All right, looking normal. There's no deviation, no perforation or any bleeding. It's good. Okay. And now the turbinates. Okay. No excessive swelling, no polyps. Okay. Okay, now I'm gonna palpate your sinuses. Okay. Okay. Okay, now I'm gonna be inspecting your mouth and your throat. Okay, I'm gonna be looking at your lips. Okay, they're nice and pink. Can you smile for me? Okay. Right, I'm I'm looking at your gums and your teeth. They're very normal, pink, no inflammation. Can you open your mouth for me, please? Okay, can you tilt your chin up? Thank you. Okay, I'm looking at the buccal mucosa. I don't see any sores or lesions. Everything's normal. Can you say ah for me? Ah. Okay, the uvula rises. The integrity of the palate seems strong. Okay, everything's good. The tonsils aren't inflamed. They're nice and pink. Okay, now I'm gonna palpate your buccal mucosa. Okay. Okay. All right. Do you have any concerns with your mouth?
No.
No? Okay.